Hi, my name is Carol and I'm a registered dental hygienist, and I'm going to be speaking on behalf of Expert Village. In this clip I'm going to demonstrate on how to correctly brush your teeth. Whenever brushing your teeth, you want to make sure to brush 2 times a day, and it's also important to brush for the full 2 minutes whenever you brush, because your main goal in brushing is to remove plaque and buildup that's on the teeth. When you start brushing, you want to make sure to get every side of every tooth. And when you start brushing, make sure to aim towards get the back teeth first. We're going to start on the inside and the outside of the upper and lower teeth. When you angle the toothbrush, you want to make sure to get it at about a 45-degree angle to the gum line, because this is mainly where the plaque buildup gets on the teeth. Whenever you start brushing, start at the back and start doing small tooth-sized circles, gradually moving forward. You want to make sure when you're brushing not to do a harsh back and forth motion, because this can cut the gums. But continue to do the small tooth-sized circles along the gum line. It's the motion that removes the plaque. You're going to do the same for the lower arch. Aim the bristles towards the gum line, do the small circles. And you're going to do this all the way around, same with on the inside of the teeth. Same 45-degree angle, small circles all the way around. And when brushing the chewing surfaces of the teeth, you want to make sure to hold the toothbrush flat on the chewing surface and go back and forth. This removes the plaque from in between the teeth. Also, whenever you're brushing the anterior teeth, you might try using the toe of the toothbrush, which is the tip of the toothbrush. It allows easier access into these areas than trying to fit the brush in horizontally. So turn your toothbrush vertically, still aiming the bristles at a 45-degree angle, and doing the small circles all the way across on the inside, and then also on the upper arch, doing the small circles. And this whole process should take about 2 minutes. Adults and kids should all brush for that amount of time. And you want to make sure to brush your teeth in the morning after you have breakfast and at nighttime before you go to bed. And this prevents plaque buildup.
That flossing is the only way to clean in between your teeth. Brushing and rinsing with mouth rinses will not do the job.
First of all, pull out some floss about the length of your forearm. Now wrap the floss around the middle fingers of each of your hands, just like so. Then you can use your pointer finger and your thumb to control the floss.
Start by rocking gently and getting the floss in between the teeth. Now remember, you'll be cleaning 2 surfaces of the teeth, this side and this side, while you're in between. Now what we're going to teach you today is called C-shaped flossing. First of all, we'll start by cleaning this side of the tooth here. So pull your floss across just like that, and you'll see that it forms a C shape. Now gently rub up and down the side of the tooth, and that cleans that side of the tooth. You'll see that plaque will start coming off onto your floss. Now while you're still in between, go to the next side, and you'll see it forms a C shape on the other side, just like that. And now rub up and down gently. This cleans the other side of the tooth. Now the same concept applies for the back teeth here. Just get into the back area there. Rock gently to get in between the teeth. Pull towards one side. In this case we're pulling towards the front, which is this way, the front way. And we're going to rub up and down the tooth. And that cleans the back side of this tooth here. Now while we're still in between, we'll form a C shape on the other back tooth there. And gently rub up and down. And that will clean that side of the tooth.
Now remember to do the same thing for every single tooth. Now remember to floss at least once a day. The best time to floss is at night before you go to bed.
With solutions, and I'm here to explain to you on when you should switch out your toothbrush for a brand new one. Basically, it's always been known that, of course, you want to get a toothbrush that has soft bristles, so therefore it promotes healthier gums. But you definitely want to switch out your toothbrush once every 2 to 3 months. because if you start to notice that the bristles on your toothbrush are wearing down or they're becoming flat, so to say, you definitely want to get a new toothbrush because it's not doing you any good to have bristles that are flat. It's not getting up underneath your gums like it should be. So also too, if after you have just gotten over like a flu or a bad cold, you definitely want to get a new toothbrush because just to think, I mean, you're brushing your teeth and you have a cold and a flu, that bacteria, if you're not, cleaning your toothbrush frequently, is going to rest in those bristles and then just kind of become like a vicious cycle of you're just promoting bad bacteria in your mouth. So whenever after you've become sick, you want to get a new toothbrush, and always change out your toothbrush at least once every 2 to 3 months. Once again, my name is Michelle, and I'm a dental assistant with Solutions, and I just explained to you on when you should switch out your toothbrush.
Dental cavities or caries is one of the most common of all disorders. It is an infection caused by a combination of carbohydrate-containing foods and bacteria that live in our mouths. When these bacteria find carbohydrates, they consume them to produce acids. The acids demineralize the hard part of the tooth, enamel and dentin, and eventually reach the pulp chamber. The bacteria are contained in a film called plaque. Plaque begins to accumulate on the teeth within 20 minutes after eating. If the plaque is not removed thoroughly and routinely, tooth decay.
Dental caries. Improper oral hygiene techniques also lead to dental diseases such as tooth decay. When microbes attack on the food debris, acids are produced. This acid demineralizes the tooth structure, caries progress, and the pulp is infected. The tooth structure destruction occurs and tooth is lost at a faster rate than gum diseases. In the case of both these diseases, there will be pain, discomfort, and disfigurement.
By now, almost everyone knows that smoking has been linked with lung disease, cancer, and heart disease. But most people aren't aware that smokers are 3 to 6 times more likely to have periodontal disease and 2 times more likely to lose teeth. Periodontal disease is an infection of the teeth, gums, and the bone that surrounds the teeth. The main cause of periodontal disease is plaque. Plaque is the sticky film of food and bacteria that forms constantly on your teeth. These bacteria produce toxins, and these toxins, combined with your body's reaction to them, destroy bone around your teeth. Smoking helps cause periodontal disease in 2 ways. It reduces the production of saliva and damages the body's ability to fight off the infection. Saliva helps wash bacteria from the teeth, so less saliva means more plaque and tartar. Saliva also contains disease-fighting antibodies that help fight destructive bacteria in the mouth. Smoking damages your immune system by causing blood vessels to constrict throughout your entire body, which reduces the flow of infection-fighting white blood cells, oxygen, and nutrients to the gums. Besides contributing to the onset of periodontal disease, continuing to smoke after periodontal treatment makes it much, much harder for your gums to heal. So if you haven't yet thought about quitting smoking, consider this. By becoming a non-smoker, you can strengthen the fight against periodontal disease and keep your teeth.